Assalamualaikum Prof. Suleman.
Walaikum Assalam. How are you, Dr. Lukman?
I'm fine. How about you?
Alhamdulillah, I'm good.
Now you are in Saudi Arabia, right? Or in?
Yes, I am in Saudi Arabia right now. I'm sitting in my office.
Okay. Yes. So do I. I also in my office because here is rain, still rain from afternoon.
I see.
Can we start?
Yeah, sure. So I need to open my presentation separately and share the screen, or I need to open it in the Zoom. Actually, I'm not sure how to.
Yeah, in the middle of the button of in the middle, you can see share screen.
I see. Got it.
But you have to open the slide first.
Got it. Got it. I think now you can see the screen. It's shared.
I can see your screen.
Okay. First of all, thank you very much, Dr. Lukman and my colleague Dina, who has been the convener during this collaboration for providing me this.
Yes? Suleman, I'm sorry. I can start by introducing yourself first.
Okay, sure.
Because my students do not know you so far.
Okay, no problem.
I will introduce. Okay. Okay, thank you. Assalamualaikum Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody.
Good afternoon, sir.
Well, it is an honor for me to guide this remarkable guest lecture organized by Faculty of Sports Science, Universitas Negeri Semarang, Indonesia. Among us, Professor Suleman will deliver speech about lesson learned from COVID-19 prevention and control in Kingdom of Saudi Arabia. Professor Suleman is from Department of Health Informatics, College of Public Health and Health Informatics, University of Health, Saudi Arabia. And I think the topic is very interesting because Prof. Suleman will has epidemiologically investigated in COVID-19 epidemic and effectiveness of government intervention in the KSA. So we can learn, especially from division of epidemiology and biostatistics. But before we get started, let me show you the rules of our guest lecture. For students, please turn on your camera and turn off your microphone. If you will ask question after Professor Suleman deliver, you can write the question from the chat menu, or you can raise your hand and speak up directly. And of course, do not sleep during the virtual lecture, and question can be asked by chat menu, or you can ask direct by raising your hand. And do not forget to subscribe YouTube channel of our department. And in the end of our virtual lecture, it will be informed the URL of e-certificate. So do not leave the Zoom. And the link is only active for only 60 minutes an hour. And here is the curriculum vitae of Professor Suleman. The name is Professor Suleman Atique, PhD. He is an assistant professor from Department of Health Informatics, College of Public Health and Health Informatics, University of Health, KSA. And he graduated from PhD in Biomedical Informatics. He is the College of Budina Nur Anggreni-Ningrum. Hello, Budina, from Taipei Medical University. And he also graduated from Master Science of Health Informatics and Doctor of Pharmacy from Islamabad. And here is the research project. I have told to you that he had a research project in spatial and temporal distribution of chronic disease in health region. And it is interesting in epidemiological investigation of COVID-19 epidemic and effectiveness of government intervention in the KSA. Because in the fifth semester of our students, we have a subject of outbreak investigation. So the student can learn from this intervention in KSA. And of his publication, almost in Hajj in the time of COVID-19, and also investigation in dengue, in HIV, also in hypothyroidism, and also in dengue in spatiotemporal and meteorological influences. So it is the time for Professor Suleman. The time is yours. Thank you.
Thank you so much, Dr. Lukman, for your kind introduction. In the beginning, I would like to ask, how much time do I have?
Less than an hour.
Okay, I will try to, because maybe it will take like 1 hour, but I will try to cut short it, hopefully. Okay, thank you so much for giving me this opportunity to talk about the COVID-19 prevention and control in the Kingdom of Saudi Arabia. So, okay, yeah. So first we will start with how it originated, COVID-19, and what is the current scenario, and what were the different checkpoints where we could stop it. So the first phase was sylvatic phase. It was like we assume it was started from some bats or some animals. And then currently we are in the phase of pandemic, like it is all over the world. So when
Professor
at the
Suleman,
time of,
I'm sorry.
yes.
You can share your PowerPoint.
I shared the screen. PowerPoint is.
You can share again, I think, because just now I share myself, and you have to
I
share
see.
again.
Uh, is it okay now?
Yeah, it works.
Okay, so here we were. Right. Yeah. So what I was talking about is how it originated and till now how it led to the global transmission. So the first step was sylvatic phase, like when at the time it started. Probably it started from the bats. So this virus is found in the bats. And then we are giving beneath each step how it was possible to control it. But at the time when it was with the bats, or when it was in the Hubei, in the latency stage, it was impossible to control, because at that time it was not in touch with the human being. And then later in the Hubei province in Wuhan, there was amplification phase, like it was almost 1 year ago, like last November, December. At that time, it was spreading inside Wuhan. If it was possible to stop at that time, check at that time, probably it wouldn't have spread that much. It didn't have transmitted so much. Then later was the threshold level. At that time, the epidemic spread from December 19 to January 21. It spread all across the China. And then from China, it is a major trade hub. And many countries around the globe, they're getting many things, anything from eating to utilities to governments. They are coming from the China. So this led to the transmission all over the world. And from January to February 2020 till now, you can see all the countries. So epicenters have been shifting. First it was China, later it was Iran till March, and then later it shifted to Europe, like Italy and France. And then after like some months, you saw it shifted to USA. So at each step, we had opportunity, except for the sylvatic and latency phase. We had the opportunity to stop it, but we couldn't reap the fruit of this opportunity. Anyways, So the steps, what we could do at that time of post epidemic reactions, we could contain the cases, like we applied these strategies of quarantine, putting the masks, all those things are mass testing, and then providing the treatment. Treatment, of course, we didn't have that time. Now we are having the positive news, like there are a couple of vaccines available, and they probably will be mass prepared by January or February, and then they will be provided to the community. So at this stage, now we have only one chance left to, start the subtype by wearing the mask, perform many testing among the community members, and then once the vaccine is available for the masses, so to apply that. So right now we are only left with this choice. So this is the condition of COVID-19 cases till yesterday in the Kingdom of Saudi Arabia. So you can see by the June and July, there were active cases were at the peak, and now we are in the end of the November, and now the cases are coming like 220, 230, like that, less than 300 now. So here is the total deaths in the Kingdom of Saudi Arabia. You can see that in the beginning there were lesser deaths, but currently the cases are down, but the number of deaths still are like it were before. So this is something which requires further research, why the number of deaths is still higher. We can see in the coming figures also about it. So you see, daily deaths, they were in the peak in the early July, but now by the end of the November, still they are not as less as the number of cases. Almost 15, 16, 15, 16 daily deaths are happening till now. So here are the number of new cases plus the new recoveries. So this green line, it is showing the new recoveries, while the yellow line, it is showing the new cases. You see the new cases have gradually dropped, but the new recoveries before, they are also going up. And now in the end of the November, you can see the number of recoveries actually is higher as compared to the new cases in the Kingdom of Saudi. This is representing the total number of cases and total number of recoveries all across the Saudi Arabia. So what has been the outcome of the closed cases? So closed cases means those who were positive, and now what is the state with them? So recovery rate is much higher as compared to the death rate. In the beginning of the epidemic, like in early March, end of March and April, there were more deaths and there were less recovery. But now you can see since the May 21 till now, there is steady curve. Preventive measures taken by the Saudi government. Here you can see how at each step, this image is little blur, but I would like to explain it. How at each step Saudi government take the measures to stop the spread. So in the first step, what they did is they suspended the attendance at the workplace and the international flight, as well as in the first step they only put the curfew in Jeddah. And that was not a total curfew, that was only from 3 p.m. like till night, because you should be aware that here in Saudi Arabia, the weather is very hot. So majority of the outing, majority of the life happens, the trade happens in the afternoon and in the night. So majority of people come out in the night. So this was in the early phase of the epidemic. So they put the curfew there, they suspended the international flight. That was end of February and early March. And then by the end of the May, mid of the March, they started suspending the schools and universities and implemented e-learning. Like we in the University of Isle, we also started teaching online by mid of the 16 or 17 March. We started. It was the middle of the semester, and we had actually started the midterm examination, and I conducted for 2 exams, and for the next exam I had to then we had to shift it to the online. And then in the third stage, that is early April, they suspended the workplace attendance for all the government employees and closure of the malls, banning the service foods in restaurants. So you can't go to a restaurant to take the food and eat. You have to go pick it up, or you can use the services which provide you the home delivery. Then in the fourth stage, they suspended the Friday prayers. Like you can't go to mosque to pray. So this one for 21 days between 7 p.m. and 6 a.m. And along with the Friday prayers, the imposed the curfew, which start from 7 p.m. to 6 a.m. Like you can't go outside in the night. Before that, you can go and bring anything you need. And then in the fifth stage, they restricted the movement between cities. Like if you are in one city, like I am in High, I can't go to Makkah, Jeddah, Riyadh, anywhere. So you are restricted to the place where you are. And then the extension of daily curfew in Makkah and Medina to start. So all other Saudi Arabia, it was starting at 7 p.m. But in Makkah and Medina, they are the spots for religious mass gathering, religious tourism. So they started the curfew in there at 3 p.m. So, and also the virtual summit for G20 leaders to discuss the global efforts against COVID-19. So this was something very special, which they initiated in Saudi Arabia. In the later, at the sixth stage, the royal order for COVID transport to be available for everyone, including citizens, residents, and those who are overstayed without legal virus. So what happened at this stage, anyone who they think is suspected to have or is having this COVID-19 is suspected, the government announced anyone can go to the hospital and get the treatment. So this was very kind gesture by the government, so that the majority of the people can be stopped to get this infection. And then in the seventh stage, that was I think early June, the curfew in Mecca and Medina, that was for 24 hours. Because Mecca and Medina, these are the two most respected religious spots in the world. So no one can go inside and no one can go come outside of this thing. And then in the end of June, in the middle of June, they started using Tatamman. It's an e-bracelet for those who are returning to the country. For example, some people are healthcare workers who went to their home countries. So to bring them back, they ask them to wear this bracelet so that you know who is coming from outside. And the curfew amended for Ramadan in the like during Ramadan, it was relaxed. Like at the breakfast time, at the futur and sahur, you can go and bring the things, but otherwise you are not allowed to go. At the same time, they started another app like Tabaud. For this I will be mentioning later. If you need to go outside, if you need to travel, you can get a permit via that app, and then you with this permit you can travel. They will give you a permit to go for a walk for like 1 hour and things like that. Moreover, in the eighth step, Saudi Arabia applied 500 millions to support international efforts for COVID-19, and they started this ODA initiative. ODA initiative was destined for the people who are outside of the kingdom and they want to come back for their work or for studies, or like those who are outside and they want to come for something inside the kingdom. And by the July, they started to bring back the situation to the normal. Slowly, they lifted the curfew. They reduced the curfew timing in all cities, but they still keep it into Makkah and Medina. And later, they even removed it. Now we are free to go. Like a couple of weeks ago, I had a chance to visit Medina, I went, like, unluckily, I couldn't go inside the mosque because I was little late. So they are managing the things on the doors. It's not that you go and you can get into the mosque. So this is how the Saudi government have been dealing with this situation. So here is like a flow chart, but the strategy Saudi Arabia have been adopting for the people who are either confirmed or the suspected. So public residents who are suspected, they are tested. If they are tested negative, they will go for home quarantine for 14 days. If they are tested positive by the uh, PCR test, they are considered confirmed. If they are symptomatic, they are quarantined, like put in the separate place, no interaction with anyone else. And if they are asymptomatic, then they are tested again for their positivity, and then if they are tested negative again, they have to be in the isolation for 14 days. Similarly, the high risk population, they tested positive by PCR. So if there is confirmed, then depending upon their condition, symptomatic or asymptomatic, they would make sure that the possibility of spread from those cases can be reduced. So in these measures, they established a command and control center. So they decided to establish a national command and control center, which the purpose for that was to monitor and follow up the cases. Moreover, they plan the preventive measure based on the national and worldwide daily updates of COVID-19. Then another objective was to limit the spread within the hospital or beyond the hospital all across the kingdom. Then optimize the hospital workforce in anticipation of the COVID-19 outbreak, because you cannot have all the workforce available in the hospitals. You have to shift it in such a way that with the least possible staff, you can have the most outcome. So this distribute uh, limited resources in national, rational, ethical, and organized way. So religious mass gatherings and COVID-19. I told you Umrah and Hajj, these are the religious gathering which happen inside the Saudi Arabia. Other than that, business, international investment, and growing tourism are the major projects for the country's Vision 2030 and make Saudi Arabia an active travel destination. They want to shift their economy from oil to the other resources. And this religious gathering, the people coming for the Hajj and Umrah, this is one of their big positives. So although the government of Saudi Arabia undertook enormous efforts each year to ensure the health, safety, and security of pilgrims, Umrah and Hajj still represent a high risk for spreading infectious disease globally, because people from all across the world, they are coming, and it requires high level efficiency to keep the things in control. Here is the graph which is showing, this is actually a part of my paper which I published earlier. You can see the number of pilgrims for the Hajj, how rapidly it is increasing till 2009, till 2019 from the previous 5 years. And this year, only 10,000 people were allowed to perform the Hajj, and that too only internally, only the residents and the citizens inside the Saudi Arabia. Everyone, no one could come out of the Saudi Arabia to perform the Hajj and Umrah. So this figure is showing you the number of the pilgrims who are coming every year from the different countries from around the globe. Here is the screenshot for that. I published actually 2 papers. One was the letter to the editor in infectious disease and health. The previous figure is from the first article, and the second article, was an editorial. And I contributed in it, talking about the Saudi, how I specifically talked about the uh, how in the Hile they try to tackle, like the nurses, they try to provide the healthcare services. The patient doesn't have to come, like telemedicine services. If you have any issue, the medical team will be going to your home to check and provide you the healthcare service. This was the main thing. So it is also talking about other countries like from Korea, from USA, from Canada, and I contributed something regarding the Middle East and Saudi Arabia. So Saudi Arabia has been proactive in implementing disease containment and working to meet communities' needs and demands in a very short time. So it is currently estimated that uh, 30 million people in Saudi Arabia, like 89% of the population, they are using internet, which is 96% of the population. They are having very good smartphones and the internet connectivity. So majority of the population has access to these smartphones and IT tools. So digital service provision is much easier than in the past and has aided in the mitigation efforts established by the government. So because of these resources, this connectivity, these IT resources, they have used this thing a lot to control it. You will see how many different applications they have been using to control it. So what were and another positive thing for them was that earlier, like 10 years ago, they had the outbreak of MERS, Middle Eastern Respiratory Syndrome. This is also originated from a coronavirus, which is mainly found in the camels. So, and the case fatality rate is much higher for the MERS. So they had those guidelines. So in the beginning, they were actually following the same guidelines which the government has developed for the MERS. So a cloud computing tool for data collection and integration for confirmed cases of Middle East respiratory syndrome. This is also co-virus, COVID. And it uses a GPS-based assessment tool. And moreover, they use Google Maps for the geographical representation of MERS COVID cases worldwide, like where the cases of MERS are, like in a GIS map. So by this way, they established a national electronic surveillance system. And in this way, they also help in the global data pool for MERS coronavirus information. So here is the summary of different applications they have been using during this COVID-19. For the digital screening of the patient, they were using two apps, Moed and Sehati. Moed means you need to make an appointment. You can't go to any hospital without appointment. There is an app. You book your appointment on that, and then you can go. Then for surveillance, they are using two apps, HESN, this is Health Electronic Surveillance Network, and there is Takasiya, which is Patient Tracing Unit. Like if someone is positive, how he is moving, where he is going, so they know the location. They are observing that patient. And then contact notification. This is about that, which I shared earlier as well. If you are positive, you have to install this app, and wherever you are going, the government is knowing where you are, especially for all the positive COVID positive people. So the general population can be informed about proximity to and contact with confirmed cases if they opt in. Like if, like right now I am sitting in my university, I have this app. If anyone will be positive, or if anyone has been in contact with the person who has COVID, so I will get a notification. So this was very effective tool actually to check the spread. And then in the follow-up, there are two more applications, Tatamman and then Tawakkalna. Tawakkalna is app, like every day when we come to the university, we have to show it. This is another very useful app. So this is quarantine and isolate people, enter information about their symptoms daily. Anyone who is positive, he has to enter his information. and the people around him will be getting this information, whether this person is positive or not, he is having symptoms or not. So there are different public health informatics tools, which the summary I actually gave. So Ministry of Health in 2018, they gave this application called MOET. The MOET word means appointment. And then in August 2019, they started this Sehati app. These things were actually already part of Vision 2030 of the Kingdom of Saudi Arabia. They want to shift their government and all those activities from the manual system to the electronic system. So the purpose for this app was to provide a wide range of health promotional campaigns that target healthy lifestyles using gamification and community-wide challenges. So both of these apps, they later were used for COVID-19 pandemic, especially for those who suspect they have COVID-19, to directly book appointment at dedicated COVID-19 clinics and drive through mass testing location around the kingdom. Like you can book the appointment, they designated specialized hospital in each city. Like in Hile, they booked King Khalid Hospital, that is the biggest hospital. So if you have anything, you can directly go to them and get the tested free of cost. Then is the surveillance. In for COVID-19 surveillance, the health electronic surveillance HESN, this is the second app which I told you, was mainly used as a reliable source of data for all COVID-19 laboratory tests. So any laboratory test conducted, either positive or negative, is reported or the data is available in this app. So this serves as a national communicable disease surveillance platform. So this was also available before the COVID-19. So it was there and now they just used it for the COVID-19. Before they were using this app for surveillance, usually in the Hajj season. Then the patient tracing. So the patient tracing unit, the Takasi, this platform was implemented in March 2020, when actually in the 2nd March, the first case of COVID-19 was reported in the Kingdom of Saudi Arabia. So this was implemented in March 2020 for the COVID-19 pandemic. So this was specifically designed for COVID-19. So its purpose was to enhance and manage contact tracing around the kingdom based on the laboratory results which were generated from the HESN. So the data from the laboratory test which was collected from HESN, the Takasi app will be using it for the contact tracing of the patients. So this is contact tracing is an essential epidemiological tool for containing the COVID-19 outbreak and enforcing future plans for shifting the lockdown safely. So once we know there are no more clusters or there are no more epidemic hubs, they slowly wanted to reduce the curfew timings. So to achieve this, the Saudi Data and Artificial Intelligence Authority, which is SDAIA, they made two smartphone apps, which currently like everyone is using. Everyone is, any office you want to go, you need to show this app. Like even when I come to my university every day morning, we have to show them this app, open it and show that we are not having any symptoms and our data is updated. So the first app is Twakkalna. It is what it means is like we trust, like the word Twakkal. So it is a GPS-enabled app to monitor and restrict individuals' movement during curfew hours with the capacity to issue permits for exceptions. During the curfew times, we were able to get the permits to move, to walk, or to bring something. But now there is no more curfew, and now we are using this app for anywhere, any government office we are going. Even we conducted exam 2-3 weeks ago. So every student have to show the screen, which if it is green, it means the patient is the person is safe. He doesn't have any symptom. And if it is red, it means he either is positive or he has been in contact with the person who is positive. So the second app is Tabaud, which means distancing to maintain the social distance. This sends de-identified data to people who come in close contact with the confirmed case of COVID-19. So I have this app. If ever I am going to be in contact with any person who is having this app and who has COVID-19, so it will notify me that I need to keep the distance. So this app follows the international Google and Apple guidelines on data privacy. So we don't know who is the person, but we know somebody there who is positive. Follow up on the COVID-19 cases. So locally published preventive and clinical guidelines give directions for home isolation with documented daily follow-ups and for tracking symptoms for mild cases and contacts. So to provide these functions, National Health Emergency Operations Center launched another app, the Suleman, which means like rest assured, you are in the safe hands. So in May 2020, the government uh, Ministry of Health announced this Tatamman app, which was associated with smartphone bracelet for individuals returning from abroad, as well as those who are isolated in their homes. So this was to make sure that everyone is in the safe hands. Then next is the healthcare delivery. So Ministry of Health is the main provider of the health services across Saudi Arabia. So the people look up to them as the main source of authentic and reliable health information for the Saudi population and the Saudi residents, like experts. So other channels of healthcare delivery includes Ministry of Defense, University Teaching Hospital, as well as the private hospital. Moreover, tertiary, secondary, and primary care facilities provide healthcare services to both the national as well as non-nationals. So in 2011, Saudi Ministry of Health agreed on a vision to improve the standards, equitability, availability, and quality of healthcare in the Kingdom of Saudi Arabia by the use of electronic communication and information technology in this sector. So according to which I mentioned earlier, their Vision 2030, there is a national transformation plan. So according to this plan, they want to transform healthcare sector from the manual to the electronic system already. So this aimed to increase access to care, improve quality, and promote the prevention of the health risk. So it highlights electronic health as an essential enabler to healthcare transformation. So it takes National Health Information Center with creating multi-sectoral coherent e-health services across the kingdom. Moreover, they also developed the 937, a call center you can call to the Ministry of Health. So any inquiry, any questions you have regarding the COVID-19, you ask anytime, they will be answering your queries. So one hospital initiated a remotely controlled robot for rounding and monitoring the intensive care unit patient. So that because many of the countries, the doctors were uh, infected because they were treating and they didn't have those equipments to make themselves safe. Like, for example, I know in Pakistan, in the beginning of the COVID, so many doctors died because of this thing, because there were not enough these protective equipments, PPEs were not available. So in Saudi Arabia, they had this controlled robot to treat and check the patient, to monitor the patient without the personal contact. So for hospital that had tele-consultation apps in place before COVID-19, whether well established or in pilot phase, some activated their apps to serve patients who do not require in-person hospital visit. Like I gave you example, in Hal there is one Saudi German hospital. This is a big group of hospital which is in the Middle East. In UAE and Saudi Arabia, in German, they have their one in Egypt. in the branch here in Hile, they were using these teleconsultations, and you can talk to the doctors and get the services at your doorstep. You don't need to go to the hospital. Moreover, they also set up WhatsApp groups to provide the healthcare services. Psychological support. Because of this thing, people were constrained in their houses. They can't move easily. So there was stress and there were psychological issues happening to the masses. So periods of pandemic are always happen to cause a surge in stress related to fear of unknown and isolation, because you are socially isolated. So for this National Center of Mental Health Promotion, they collaborated with the developers of local mobile and counseling app. They developed Labia. It is to provide free sessions for the people who experience anxiety or panic symptoms in the current situation. Moreover, Saudi Commission for Health Specialists (SCFHS), which is actually organizing body for all the health-related issues for licensing of the medical professionals, they are conducting exams and maintaining the healthcare workforce. They set a mental health support service for all healthcare professionals in the kingdom. They not only registered healthcare professionals but also sent them SMS messages requiring about their safety and advising them to keep the safe. Next is the telepharmacy. So Ministry of Health and other healthcare facilities sent medications to patients via courier companies or established telepharmacy services. Like I gave you example of Saudi German hospital. Even in other hospitals inside the Kingdom of Saudi Arabia, they will provide you the medication at your doorstep. Furthermore, Ministry of Health Ministry of Health sent out SMS text reminder to all healthcare providers with active professional registration to use the electronic prescription services in collaboration with the private sector pharmacy. Earlier, if we visit any hospital, we can take the medication from the same hospital or a primary care center. But now you go to see the doctor, and they will give you a prescription number and they will tell you a designated pharmacy. You can go there and pick up your medication from there. So this was started just when the COVID-19 started here. So the example for this is an Anath mobile app, which enables providers to directly electronically prescribe medications to the patients by credentialed and licensed providers. Like the licensed doctors, they are able to prescribe medications by using these apps. Moreover, there have been another app which I am also using, Vasafati. This means my prescription. It is the official gateway for e-prescription in the Ministry of Health free services, and Seha mobile teleconsultation app, which provides patients with e-prescriptions via SMS text messages. A message following a medical consultation with a physician. Educational sector digitalization. So before we were talking about what has been happening in the health sector, but now how they deal with the educational sector by using these digitalization tools. So according to Saudi statistics, approximately 13,050, 1,35,000, like 10 lakh students are enrolled in 28 governmental and 34 private higher education institutes. So there are approximately 5,000 schools across the kingdom that provide secondary level education both in public as well as private sector institutions. So this electronic is not electronic learning is not new in the kingdom. The first decade, its first decade was 1990 to 2000, when Saudi Arabia education system was supported by evolution of computer technology as well as World Wide Web. In 2002, Saudi Arabia established a national school e-learning platform with tailored electronic lessons. Tailored electronic lessons means as required by the users. So the following year witnessed expansions and enhancement of e-learning in collaboration with international partners. In 2017, as part of the Vision 2030, Ministry of Education established a National Center for E-Learning. So this serves to supervise and support e-learning across Kingdom of Saudi Arabia. So the current COVID-19 pandemic poses immense challenges to maintaining continuity of educational services across Saudi Arabia. It is also worth noting that all educational institutions, including higher education institutions, continued delivery of education during the lockdown period. So both public and private institutions used various two-way e-learning methods to continue teaching and student learning. So there are different tools, different portal they have been using, like Blackboard, which we are currently using because this whole semester is online. We are using this platform called Blackboard for delivering lectures online, for exams online, for assignments and everything. Similarly, other portals include McGraw Hill Connect, as well as the Zoom, which we are using now, Google Class, as well as the FaceTime. So these are different tools, portals, which have been used for providing the education in the Kingdom of Saudi Arabia. Another app for this one, which was used, is IN, which means I and vschool.sa. So these two apps they have been using for providing the education across the kingdom. Telecommunication, commercial, as well as miscellaneous digital services. So there are three major companies: Saudi Telecom Company, STC, Mobile, and the ZAN. They have announced free of charge data services to facilitate the smooth delivery of e-learning as well as healthcare delivery during the pandemic. So before the COVID-19 and after that, there was 33% surge, like there were 33% more usage of the internet and these technologies. So this was supported by Saudi Communication and Information Technology Commission, CITC. So prior to COVID-19 pandemic, CITC also had launched a guide to inform consumers about the trusted available mobile apps that are officially registered within the commission. Here you can see the Ministry of Health. This is, you can say, they are using here this Instagram as a tool to share the information. So this is a page actually by the Saudi Ministry of Health, and they used Instagram as a tool to share the information, so that because many people inside the Saudi Arabia, they are using either Instagram or Facebook or Twitter. Like different countries have different tools they prefer to use. So the Ministry of Health, they use all the available different tools to share the information. So the G20 International Economic Leaders Summit, scheduled in March 2020 and hosted by Saudi Arabia, that was also done digitally. So this summit hosted 19 countries, European Union, as well as the central bank governors. Saudi Arabia initiated G20 Extraordinary Virtual Leaders Summit on COVID-19 using video conferencing that was inclusive of all the international delegates. It is important to mention that this was developed as well as coordinated by the uh, Saudi Data and Artificial Intelligence Authority, SDAI. So risk communication via social media, like As I told you about the Instagram, they have been using different platforms like Twitter, Facebook, YouTube, Snapchat, Instagram, and TikTok to distribute the health education materials that provide the information about that. So they provided the information regarding how the COVID-19 is transmitted and how we can prevent it. As the pandemic progressed and new scenarios emerged, the literature was modified and expanded to accommodate these changes. The new information was updated as well as provided in different languages. For example, in English, other than the Arabic, they provided the information in English, in Portuguese, French, Russian, Tagalog, Spanish as well as Urdu, because there are people from all over the world, they are coming here. So they provide the information to them about the changing situation of COVID-19 in Kingdom of Saudi Arabia as well as globally. Here is the example for that. Daily, the Ministry of Health would uh, give the like this a dashboard to show the number of cases. For example, in the first one, there are number of cases according to each city, the new number of cases, new recoveries, as well as new mortality in Arabic plus in English. In the second one, that is in, if I'm not wrong, this is in Indonesian language. So the information on this page in the second image is in for the Indonesian people. And the third one, I gave only three examples. The third one is in Urdu. Like the information is available in Urdu. Similarly, in Hindi and for the Filipino nationals. So they were daily giving the information about as well as precautions about new deaths, new cases, and the number of cases according to each location they have been providing using this tool. And then when they started the travel ban, so that the people from the countries who are hit more by the COVID-19, they cannot get in. Saudi Arabia was among the first countries to implement early and unprecedented precautionary measures to prevent COVID-19 introduction into the country or to mitigate its impact when it is coming. So on February 6, a month before COVID-19 case arrives in the country, the first proactive decision was issued by the Saudi government in response to the spread of COVID-19 pandemic. So they stopped all the direct flights between Saudi Arabia and China. So this was the first step. And then February 27, the government suspended entry of all international Umrah pilgrims and tourists and monitored all entry points to Makkah and Medina. By February 28, Saudi Arabia banned inbound travel of individuals from core COVID-19 affected countries, including GCC cities. This Gulf Cooperation Council, like Egypt, UAE, Bahrain, Qatar, those countries who are around the kingdom, all the Arabic countries, they even stopped the travel from that. So this not only minimized the chance of COVID introduction into the kingdom, but also prevent the exportation of cases to other countries. So Umrah was completely suspended by March 4th. 2nd March, we faced the first case, and 4th March, they suspended the Umrah. And the two holy mosques in Makkah and Medina were put to daily closure for cleaning and disinfection by March 5th. So next day, they were, even now, they are every day disinfecting and cleaning the mosque, changing the prayer mats. On March 8th, government shifted schools and universities to remote learning and virtual classroom. Like everything was online, the teaching, the exams. So this was accompanied by a travel ban to all affected countries and putting in place a mandatory quarantine for passengers who already arrived from these countries. If someone is coming from any endemic country, they would put them in the quarantine. On March 9, Saudi Arabia pledged 10 million US dollars to World Health Organization to help in their efforts to fight the pandemic. And by March 12th, all social and governmental gatherings and events were suspended or postponed, including the Saudi African and Arab African summit. So there were some conferences supposed to happen, so they were also delayed. So here is this is the web page by the Ministry of Health. You can see I have highlighted it. So they made the information available in English on the Ministry of Health, English, Hindi, Urdu, Bengali, Afghani, Filipino, Indonesian, in addition to Arabic. Of course, that is available in Arabic, but according to the number of people, because more people are from India, from Pakistan, Bangladesh, Indonesia, Philippines, and Afghan nationals. So they make the website in those languages as well as so that the right information is available to all the people, all the residents. This is finally, this is a little bit about misinformation. This is part of my another paper, which is talking about the misinformation in COVID-19 in Saudi Arabia and how Saudi government tackled it. I just take this table from my that paper, which is under review now. So the first type of information is health related misinformation relevant to COVID-19. So the ministry responding is Ministry of Health. So they announced that do not believe any information about COVID-19 other than which is coming from Ministry of Health and advise the people to seek information only from the official sources. Like I gave you those screenshots, which is showing the information from the official Ministry of Health resources. The second type of misinformation is regarding false nutritional information. So the ministry who was responsible to respond it is National Nutritional Committee and Saudi Food and Drug Authority. So they clarified that there are no specific foods proven to significantly enhance immunity and prevent COVID-19. As you know, during the COVID-19, some people started, you need to eat this, you need to take this kind of vitamins or food to prevent. So to tackle this kind of misinformation, Saudi Arabia also was proactive. Then the third type of misinformation is regarding the rumors about COVID-19 control measure. So Ministry of Interior was the relevant authority. They cautioned that severe provisions of law will be applied against those spreading rumors and announced that a fine of 1 million and jail term for 5 years if spread rumors on social media and apps or publishing false information. Because in Saudi Arabia, what it happened in one region called Jazan, they said if you are recovering from COVID-19, they are giving some gifts or like 1500 riyal. Like there was one video circulating about that. So after that, they made these changes. Then the fourth type of misinformation is regarding the travel restriction or opening of the international. Till now, the international flights are banned, but only special flights are being arranged between the countries. So the General Authority of Civil Aviation, GACA, and Saudi Arabian Airlines Saudia, as well as the Jawazat, which is the General Directorate of Passports, any immigration matters, they deal with it. So they denied the rumors about the resumption of international flights on regular basis and suggested that people should follow official sources to avoid rumors or misleading news. And that is the end of this presentation. And now you are open to ask any question. And thank you.
Thank you very much for your informative and interesting talk, Professor Suleman. I think this topic will make us to ask some questions in the slide, in the Zoom chat. We have a question from Ibu Dina Nur Anggraini, Professor Dina. She asks about, Salam Professor Suleman, long time no see. Assistant Prof. Lala from Heidelberg University also follow this lecture. Have you remember her?
Yeah, I know both of
I have
them.
question.
Dina was my colleague and Lala, when I went to Germany as exchange student, she was my office mate. So yeah, thank you, Lala and Dina. You're right, but I think I have been in contact time and
Yeah.
on.
Professor Dina asks about the vaccine for COVID-19. Is Kingdom of Saudi Arabia have planned to use COVID-19 vaccine to control the pandemic?
Vaccine, yeah. Saudi Arabia, actually 2 days
Yeah.
ago, the king already announced that they will acquire the vaccine and they will provide to all the residents, not just the Saudi citizen, Saudi residents free of cost. But they, in the first step, they will not give the vaccine to the people, to the population younger than 16 years, because still it is in the fourth clinical trial. So in the first step, they are not going to the people who are less younger than 16 years. All other people, probably as the vaccine is available by maybe January or February, they are going to provide it free of cost.
Is it an obligation when we enter the Haram Mosque? We have to be vaccinated in the next year, Professor?
No, there is no such news. Till now, there is no such news.
Okay. And
Yeah.
next question: how Kingdom of Saudi of Arabia handle this misinformation or hoax related COVID?
Yeah, actually the final slide, which I
Yeah.
was, that is giving all the information. What they did is they made, they used different social media tools, and they responded right away. If there is any misinformation, they right away responded it that this is right or wrong. And actually, when I was writing this paper, this misinformation handling, in the beginning, there were like in one day, there were 257 complaints about the misinformation. And they actually caught 257 people and they put them in the jail, those who were involved in spreading this misinformation. They use the social media tools to provide the relevant information by the relevant authority. And if someone is providing the wrong information, they caught them and put them in the jail.
Okay, thank you. My
Yeah.
questions.
Yeah.
You know that Indonesian people has a when the Kingdom of Saudi open the Hajj,
Yeah.
close the Hajj, close the Umrah, it's
Yeah.
impact too many to Indonesian people. And
Yeah.
now Hajj and Umrah open for in from Saudi Arabic people and out of Saudi Arabia, right? Or still
Yes. So out of Saudi Arabia also, it is open
also.
now.
And
Yeah, because
my
from Pakistan there are two flights came with the
uh,
Umrah pilgrims.
my question is, what are the government's consideration to open Masjid Al Haram for Hajj and Umrah?
It is already open. The what they are doing is, because I visited Medina, I plan to go Makkah probably in 2 weeks. What they do is, after every prayer, first thing is they have put the checkpoints. They have certain capacity. If this capacity is filled, you cannot go. If you want to visit a particular, like Rawza Rasul, like you want to go to the grave of Prophet, you need to have an appointment. Like you will get a permit in this app called Tawakkalna. You can get the permit, and they will give you a specific time. Similarly, for the Umrah, you can get the permit. They will give you the time. Maximum you will have 3 hours. You can go into that. They are observing you, and within 3 hours you have to finish your Umrah, and then you have to come back. And social distancing, they are observing. Probably you have seen some of the images. So they are organizing very well. Moreover, in the Medina, in front of the Masjid al Nabawi, there is the Ministry of Health. You can say checkpoint by them. So their vehicles are there, and they are observing, disinfecting, cleaning, as well as continuously observing the people. If something happens, the what we call as ASAF, this ambulance is available. If anything they suspect is bad, they are directly observing it and cleaning everywhere. Like in the morning, after Fajr prayer, they would remove all the carpets, all the prayer mats, and then they will clean it, put it again at the Zohar time, like this. And even with that, you have to have your own musalla, your own prayer mat. You can bring it and then you can pray. Without that, if like in the Masjid Quba, they put these polythene prayer mats. If you don't have your own mat, they will give you. You take it, pray on that, and once you come back, you throw it away. So this kind of precautionary measure they are taking in all these mosques.
I can imagine how hard the officer always monitor the
Yeah,
the
but
people around the Kaaba.
yes, yes. That is why they have put these things, strict measures, and they know you cannot go to Makkah without Umrah appointment. They will tell you the day. They will tell you the time. Only during that day and time you can go and come back.
Okay. Next question from my students from Mamlu Atul Hikmah from Hikmah. Uh, I'm very interested in the use of application and technology in COVID-19 management in Saudi Arabia. I want
Mhm.
to ask the professor, did the Ministry of Health there uh, cooperate with certain companies to make this application?
These this there is Saudi Digitalization and Artificial Intelligence Authority. They probably collaborated with the Saudi Telecom. Saudi Telecom. This is their one of the network providers to make these applications. So this is internal to the Kingdom of Saudi. This is not. They are not collaborating with the people outside of the ministry.
Okay. And next question from Professor Lala. How are you, Professor Suleman?
I'm good, thank you, Lala. How are you? This is very nice question.
Professor Lala. Professor Lala would like to ask about how to monitor the person how come from abroad. Are they wearing the bracelet or some
Uh,
alert
what
or sign?
what they are doing is once you come outside of the kingdom, the first thing is you have to have your application, and either if you have your own residence, you will go there and there will be application in your mobile which is telling the location. If you don't have like residence like that, the hotels are there near the airport. They will put you there for 14 days and then they are monitoring you for 14 days. After 14 days, they will do your this PCR test. Once you are negative, then you are able to move. And there is actually 1,000 real fine if you move without this mask. You know, they are very strict. They are always watching on the street. If someone is going without the mask, they will catch. And
Okay.
as you leave your room, for example, you travel from outside, like it happened.
Mm.
If you leave your room, they will they will know that you have left your location. You will get the SMS right away.
So always being monitored.
Always being monitored. They are very strong monitoring system.
And sorry, if is there any other language like Bahasa Indonesia in that application? Because majority of people in when doing the Hajj is from Indonesia, for example.
Yes, the Indonesia in Bahasa, in Urdu, in Hindi, in
Oh,
like all like 5, 6 major languages.
okay.
Not only the application but the website as well.
Okay. Next question from Anissa. Assalamualaikum Prof. Suleman. There are many applications that have been launched to simplify the prevention and control.
Mhm.
What health intervention are given to population who do not yet have smartphones, tablets, or other
Uh,
communication technologies?
this is very interesting question. But here in Saudi Arabia, there are two things. One is car, one is the mobile. Everyone is having that. And once actually, even when they are car, they are more focusing on the mobile. So everyone is having that. This is very rare. But one advantage they have is Saudi population is very dispersed. there are, Saudi Arabia is a big country, so the people are dispersed like at a distance. Strong infrastructure and network. Uh, Other than that, there is only one thing, that the police is, they are watching you. They are surveillancing.
My question is, all region in Saudi Arabia have a internet connection or some
Yes,
area?
yes,
Or
yes. All. It depends on the type of communication network you have. For example, there's Saudi Telecom's STC. This is available in any place. The relatively newer company is Zen. This is very good in cities, but as you go away from the city, like in the uh, like city or the where people are living, the connectivity is good. But if you are on the road between in the middle of two cities and there is no population, then the connectivity is not good for that. But for STC and mobile, the connectivity is good.
different in Indonesia. In one region, all card don't have a connection in the internet, different with Saudi Arabia.
Yeah, because here their economy is good, they can afford, and they have built a nice infrastructure for their residents.
Okay, next question from Anissa, a different Anissa. Now Anissa Dwi, previous Anissa Siva. Anissa Dwi asks about because had because professor had experience in MERS outbreak in 2012. The Saudi Arabian Kingdom was better prepared for COVID-19 pandemic by
Exactly.
turning offline to online in the
Yeah.
prevention and health promotion and the education sector. After
Yeah.
Ramadan, the number of COVID-19 increased. And this also happened in Indonesia. What can you suggest for Indonesia to reduce the number of COVID-19 after long year-end holiday that will be implemented by Indonesia soon?
The
We will
only
face
on
the
the
long
only
holiday.
in the current scenario, the only thing which is useful and effective is maintaining the social distancing and wearing the masks. The problem, what happened in the end of Ramadan, or like what will happen when the year is ending, the mass gathering will increase. People will come close to each other. For example, in some countries, I'm sure in Indonesia now the weather is not cold and humid. It is definitely humid, but not cold and humid. So if the humidity is more, I feel the chance of the dispersion of the virus is increased. So more people get infected. So if you are inside the home, you can have dehumidifier. This could help. Plus, always follow these masks and maintain the social distancing as much as possible. Right now, these are the only strategies available. But we have to wait till vaccine is here, and then, inshallah, things will be better.
Amin. Next question from Regina. Good afternoon, Professor Sulaiman. My name is Regina. I would like to ask about the prevention of transmission of COVID-19 towards, oh, the question is same. Are there any restriction or regulation to prevent the COVID-19 curve from rising again in Saudi Arabia?
Right now, they have make sure that you don't come out without the mask. This is and then anywhere you are going, they are observing via the applications whether you have any exposure to a person who is positive, or you are positive, or anybody. So these are the things they are observing, and this is till now it is going very successful. Since almost 1 month, the number of cases is now less than 500, and since last week it is even less than 300 now. So this is effective.
Okay, next question. Wah, interesting. Next question from Sarifah. Assalamualaikum, Professor Suleman. My name is Sarifah. I'm
So,
curious about labai.
Lavaya.
Am I right? That used as
Yes.
psychological support during this pandemic in Saudi Arabia. how does it work, and what is the difference with counseling services by psychologists?
With this app, actually, they the provider or the counselor is available. They are uh, providing you the information and giving you the consultation. This is like, you can say, like, you are able to talk to a certified counselor than the one who is providing you the advice or information that how you can keep yourself busy or uh, be safe. Like, this is just a communication app.
Okay, my question, because I still curious about this pandemic COVID-19 in Indonesia. The case is still increased day by day. Uh, Sometimes the people have a sign and symptom, and the rest they do not have sign and symptom. Is it
Mhm.
possible that in the future this COVID-19 become a common flu, common influenza like like now?
It is quite possible, but if the vaccine is there, then I think it, it will be fine. For example, now we have influenza. Every year, like, I will give my personal example. Every year I get influenza like 2 or 3 times. Whenever the weather will change abruptly, I get flu. But since 2 years I'm getting this influenza vaccine, I didn't get the flu. So similarly for COVID-19, once the vaccine is available, I think it will not become common. It will be gone. But we should be ready, but something more worse. Definitely something more strong will come.
Any question from students? You can ask directly, please. Speak up, raise your hand first. Any question from students? Any questions? No? Enough? From international class, is there any questions? No? No, there is no voice.
Okay. Okay, in the end, I would like to say especially thanks to Professor Lukman and Dina and Professor Lala for your kindness, for having me. And for the student, I would like to say that my information is there. If you are interested to uh, do something similar, or you need any information regarding the information which I shared, my information is there, or you can take it from Professor Lukman. You can communicate with me for any of your work or for your thesis or something like that. So I will be happy to collaborate and help.
Okay, thank you. Unfortunately, we come to the end of our session, Professor. Thank you. I would like to say thanks again for having you in this virtual lecture.
Thank you so much.
Thank you for the student also, Professor Dina and Professor Lala there. And before we closing this virtual lecture, please we can take picture together. Please open your video, please. Uh, 1, 2, 3. Next slide. Number 2. 1, 2, 3. Number 3. Okay, 1, 2, 3. Number 4. Afifah, are you there? Ara, Aziza, number 4. Number 5. Number 5. Please open the microphone. Sorry, the camera. Please open the camera, number 5. Okay, thank you. Thank you again to Professor Suleman for having you in this virtual lecture.
Thank you so
And
much.
please give once again a big round of applause for Professor Suleman. Hopefully this virtual lecture will be beneficial for everybody, for me, for my students, and for all here. Thank you for your attention. I close with Assalamualaikum warahmatullahi wabarakatuh.
Walaikum salam. See you.
Waalaikumsalam warahmatullah.
Thank you, Professor. And for students, I will share about the information. Please keep in this Zoom. Here is the attendance list. Please fill the form in s.id/phunnes4. Please write your email address correctly, and this link is active for only 60 minutes. Make sure that your email address correctly. I will copy it in, sorry. I will copy it in the chat room. Wait. Okay, make sure that your email address is correct. I do not want to resend the certificate if you write the email incorrectly. Thank you. Any question from my student? Any question? No? Or you can ask in Arabic, in Bahasa Arab. It's okay. Okay, thank you for your attention. I will close this meeting. See you next time. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Waalaikumsalam
wabarakatuh.
wabarakatuh.
Thank you, Mr.
Thanks, Prof. Lukman.
Thank you.
You are welcome anytime.